All right, y'all. So I am headed into my next tattoo removal session. I'm gonna walk y'all through the process. I'm so nervous. I'm always so nervous. All right, y'all. So a lot of you may not know this, but I got a tattoo on my wrist, which I absolutely hate. But thank God you can get tattoos covered and removed and all of that. I'm going for getting it completely removed. I don't want to see it anymore. I was 15 when I got it. So it looks like a 15-year-old mind tattoo. So I'm here at Southern Lane and laserspa here in Atlanta. They take care of me. I think I'm at my 8th session. They say it takes about 6 to 8 sessions, depending on your tattoo, depending on the ink. So mine is taking a little longer. I think I'm on my 8th session, like I said, and we'll see how it goes from here. Right now, I'm just sitting with some numbing cream on me because I'm scared as getting this done. It's quick, but it hurts. So I used to get a needle as opposed to the cream, but I find that the needle hurts just as bad as the tattoo, so I eliminated that and I cut that out, so I go straight for the tattoo removal. So laser removal it feels like you're getting a tattoo all over again, but quicker. I think my wrist takes 9 seconds because it's small. I'll show y'all once I get this off. And I think my back is 18 seconds, so it's not that bad, but if you are not prone or like pain or needles, which I don't, you might want to get some numbing cream, but I'm going to take y'all through the process. Right now I'm just getting numbed, and I'll be back so we can show you the process.
Of course, yeah, we're applying a numbing cream right now, benzocaine, lidocaine, tetracaine. It's just going to help with the treatment for her to be a little bit more comfortable during the treatment. We'll still ice before the treatment and use our air chiller to help as well.
Okay. This helps a little bit with the process. I still get nervous.
That's okay. You'll be fine.
I'm like the kid who's getting the needle. I never get used to it.
I totally understand.
Yeah, no. It's okay though. I'm ready to get the process over with.
All right, awesome. So massage chair, if you want to use that at all.
Okay.
You just hit that button there and then whichever one you like, okay?
Thank you.
You're very welcome. All right, there you go.
When I take my pants down, so we use the rest of them, this will stay up. The plastic will keep it up.
If I put it all the way up.
All right, I'm ready to get this out the way. Come on. I don't want to be here much longer. Many more sessions.
I totally understand.
No way. We're getting there. We're almost there. I just want to come back and see you guys for other things.
Exactly. A nice facial, some laser,
Laser, some IV.
Yeah. All right, girl.
Hydration, not tattoo removal.
Yes.
Yeah, it's pretty clear.
Yeah.
It's going.
Awesome.
When I look, and sometimes I'm like, damn, it's still here. But then when I look at before and after pictures,
Oh yeah, big
I'm
difference,
like,
right?
okay, it's getting lighter. All I want is my beauty mark right there. I want my wrist back.
That's right.
This is from 2017 to today. Look at the difference.
So that was before we started, and that one is today.
So this is a little, like, actually 2 years in 1 week.
Yep, you got
And
it.
that's only because I took months off at a time. I would be filming here, and then I would go to LA, and I would be there for 5-6 months, and I never wanted to go to another spot and get treated. But they say when you wait, months at a time to go back, the ink settles, and it helps it to heal, and that's better for the process, obviously.
Yeah, so what this laser does is it targets the ink particles, which are large, and it breaks them up and shatters them into tiny particles. And then our body flushes that out. So it does deal with the lymphatic system. So generally we recommend 6 to 8 weeks. We can treat you again. However, if you wait, 3 months, 5 months, it's totally fine. It's just giving your body more time to flush out that ink. So yeah, we're so happy.
Love it. Almost
today.
done. Let's go.
No, we're just removing, she really just has like some, very fine little hairs, but just so that the laser doesn't target it. It's okay, but we just don't want to smell that basically. So we're just giving it a nice clean service, and then I alcoholed it after the numbing cream was removed. And there's really just kind of a shadow of that ink color, so we're doing
It's
really
almost
well.
gone. I can't tell what it says. It looks like a scar, and I know it does because usually when I'm at work, we have to like cover it because it still will look too much like a tattoo. But then it looks like a scar on camera, which is good for a superhero. The superhero has scar in wound battles.
That's right, girl.
Battle wounds, rather. So it makes sense.
Our wavelength that we are using.
I love my shotties.
There you are.
Thank you.
You're welcome. And I have you down for treatment number 8.
Oh, it is 8. It's 8.
Last time was 7. What were you thinking?
I said it was 8. I'm
Oh, hey, good job,
I said it was 8.
Good guess.
I was like, I think it's 8. I'm not sure. Oh, good. So we're on track.
We are on track because with tattoo,
Yeah.
it can be harder to get rid of. And plus the location. So tattoos closest to the heart generally respond faster, right?
Right.
Blood flow and the lymphatic system's up here. So tattoos on the extremities, they tend to take a little bit longer.
And the back is going pretty much quicker, but that's connected and closer to the heart. So
Yeah, I'm so glad you're getting good results with the back. That's great.
Yeah. And the back is a little bigger.
Alrighty, we are ready whenever you are, okay? Okay.
So I've timed this. It's normally 8 seconds.
Okay.
We'll see.
Do you like it all done at the same time? Like you don't like to take little breaks?
No, let's just.
Okay.
Yeah.
So what I normally do, I'll do a few pulses and I'll just wait like 30 seconds just to make sure your sleep's okay, and then I'll continue. Does that sound good? Laser hair removal is not as intense.
So we just have some Aqua 4, which I'll continue to put on my wrist and my back.
Yeah.
Put it right on the surface to keep it oiled, right? And that so it doesn't dry out.
You gotta to protect the skin as the skin is
I know
healing.
the process.
Good. All right, wrist is done.
Believe it or not, I had one small tube of Aqua 4 for the last year and a half. I just had to buy another one. I was doing good.
All right. So how are you comfortable to do the back? Do you want to?
Oh Lord.
I want to get her fit.
Just rest your arms up like that if that's comfortable. Okay? I'm gonna do one little pulse and then you'll know how it feels, okay?
Oh, here goes nothing.
All right, how was that?
Let's go.
Okay. It looks really good. Good. You doing okay, sweetie? Almost done. Okay. Oh, good job.
Lord. Jesus help me. It's not that bad.
Gotta squeeze by you, sweetie.
Oh, you're good. I'm just gonna grab this aqua cord. Not too bad, right?
No.
It's so fast.
And I've learned that with the lidocaine, the needle, it hurts.
Oh.
And that process hurts. Having it
Yes.
under the skin, and
Yes.
I just eliminate that.
Well, that's
You wrist is
the back is a really sensitive area.
the wrist is much easier to do. Am I ashy? Well, you're wiping it. So
No, you're not. I'm gonna take that picture.
Where's that little ball? Is the ball
Oh
in
my
there?
goodness, we lost it. We have to get another one.
Okay.
I'm so sorry. Let's see, did that turn out a little bit clear? Let's see if this angle is better. Okay, I'm gonna put some ice on there and then I'm gonna show you these before and after. feel okay?
Mm-hmm.
See, the ink is a little deeper,
Okay.
right, compared to the butterfly in the middle.
Yeah.
So I think that's why it's hanging on a little bit. Were they? So it's a little bit of green, right?
There are two different tattoo places too.
Okay. Yeah, because the butterfly looks, I mean, it's totally clear. So it's just
Can I see?
Yeah, that right there. You can take off your glasses.
Is that what it really looks like right now? Like today?
Yeah.
Oh my God, it's
just
almost
those little
gone.
bits. Yeah.
That makes me so happy. I can't see the middle one.
No, I don't see it. I don't see the ink there.
Oh wow.
Yeah.
All right, everybody, this is my doctor, Dr. Ambrozic. He's been really great along this journey. He's usually here to hold my hand, so you came in perfect timing. And then you can let them know a little bit about yourself and Southern Maine Laser Spa.
Sure. Yeah, I'm Dr. Rick Ambrozic, or Dr. Rick, people like to call me. We have amazing patients like Nafessa here that come in all the time, and we just do everything we can. We use the best state-of-the-art equipment to help heal our patients, get them better as quickly and as easily as possible. And she's done tremendous. She's had a couple treatments with tattoo removal, and they look great. We've got some pictures we can show you all a little later from the before and where we are today. That it works for all skin types, all types of tattoos, whether they're black or they're colored tattoos, whether they're huge ones all across your body, or if they're a small tattoo on your ankle or part of your body. So we take care of it all. And Amy here is tremendous. She's our lead esthetician. She's fantastic. And she's going to be doing the procedure today.
All right, let's get this done.
All right, give me a heads up. I will. I'll let you know. All right, you ready? So I'm going to do this little spot right here, okay?
Okay.
Ready? All right. Okay, sweetie. A little bit more. Okay. Good job. Woo! Ready for the other side?
Yes.
All right, let's get three. A little bit more. Okay. Woo! That looks really good. Awesome. What do you think? Just let that be right now. Middle part?
Yeah, it looks, there's nothing in the middle. Yeah, it looks amazing.
That looks really good.
You've done so well. This looks fantastic.
All right, so bandage you up and you'll
Oh my God, it used to be so much longer.
the middle part is the
Yeah.
top part, right?
I'm so happy I don't have to get the middle done.
Yeah, it looks
Talk about
fantastic.
progress.
Yeah, you've come along, girl. It looks fantastic.
So happy. It's not easy staying. I see why people give up when getting it removed, but it's I see why people give up, but then again, I'm like, if you just stick with it, it's not that bad of a
Right.
process.
Oh yeah, for sure.
Because it is pretty. It can be painful, but it's quick. That's the thing.
It's real
Like,
quick.
everybody's like, how does it feel? I'm like, I'm not gonna lie. It hurts a little, but it's so fast. It's over so quick.
Exactly, you got it. All right, I'll just put a little gauze on that.
So this was session 8. All right.
Thank you. It was such a pleasure seeing you today.
Thank you. We're almost there.
We're there, yeah. You enjoy the rest of your day, okay?
Thank you so much.